During the year, the common cold and flu usually have two peaks. The first peak happens in autumn, from September to November, and the second one in spring, around March and April. At these times, almost every third person catches a cold or flu. For some people, symptoms can be even more severe than usual. You may have also noticed that sometimes, after you start feeling better, the illness returns, and the symptoms may be worse than before. That's what we'll talk about: which infections attack us, how to protect ourselves, and how to prevent their return. Actually, the common cold can be caused by more than 200 different types of viruses. That's why it's so difficult to create a vaccine or fully protect the immune system from all of them. That's also the reason we catch colds every year. The common cold and the flu may look similar at first, but they are not the same illness. They're caused by different viruses and affect the body in very different ways. The common cold is most often caused by rhinoviruses, around 40% of all cases. Other frequent ones are coronaviruses, about 15%, adenoviruses, parainfluenza, and enteroviruses. These viruses prefer the upper airways, the nose, throat, and sinuses, so they usually cause runny nose, sneezing, sore throat, and mild fatigue. The flu, on the other hand, is caused only by influenza viruses, mainly type A and B. They infect deeper parts of the respiratory tract, so the symptoms are more systemic and sudden: high fever, body aches, chills, and deep fatigue. Influenza can cause muscle pain, headache behind the eyes, and dry, exhausting cough. These are its classic hallmarks. While a cold develops slowly over 1 to 2 days, the flu hits abruptly, often within hours. You might feel fine in the morning and completely exhausted by the evening. So, if you have high fever, chills, body pain, and feel exhausted, it's influenza. And, if you have runny nose, sneezing, mild sore throat, and no fever, it's almost always a cold. However, both illnesses share one common rule: they are viral, not bacterial, so antibiotics don't help and can even delay recovery. The key to faster healing is rest, fluids, and protection of the mucosa, because the virus first attacks the cells of the nasal and throat lining, causing them to swell and leak fluid, which produces congestion, mucus, and that familiar heavy feeling in the head. Most people recover from the common cold within 7 to 10 days, while flu can last 10 to 14 days, and fatigue may stay for another week after the fever ends. When we say protect the mucosa, we mean protecting the thin, moist layer that covers the inside of the nose, throat, and airways, because that's the virus's first target. If this layer stays moist, clean, and well nourished, viruses can't easily attach to its cells or multiply inside them. The simplest protection is hydration. Drink warm fluids regularly: water, tea with lemon or honey, and clear soups. Warmth keeps mucus thin and helps the cilia, tiny hair-like cells, push viruses and debris out of your nose and throat. Steam inhalation for 5 to 10 minutes twice a day also works well. You can use plain hot water or add a pinch of sea salt or chamomile. This helps loosen mucus, calm inflammation, and clear the sinuses. For a runny or congested nose, the best choice is isotonic saline spray or sea salt solution, 2 to 3 sprays in each nostril, several times a day. It washes out viral particles, reduces swelling, and helps natural healing. It's safe even for children and can be used throughout the illness. If nasal swelling is very strong, decongestant sprays like oxymetazoline or xylometazoline can be used. But only for no more than 3 days, otherwise the nose becomes dependent and worsens afterward, a rebound effect called rhinitis medicamentosa. Antihistamines like loratadine 10 mg once daily or cetirizine 10 mg once daily can reduce sneezing and watery discharge, especially when symptoms are very disturbing. For people with sensitive or allergic noses, they help significantly. To reduce throat irritation, gargling with warm salt water, half a teaspoon of salt in a glass of water, several times daily reduces swelling and viral load. Honey is also effective. 1 teaspoon 2 to 3 times daily soothes the throat and has mild antiviral activity. For fever or muscle aches, paracetamol 500 to 1000 mg every 6 hours or ibuprofen 400 mg every 8 hours are standard, according to tolerance. Hydration is again key. Fever and rapid breathing cause fluid loss, which thickens mucus and slows clearance from the bronchi. Drink at least 2 to 2.5 liters per day of fluids, warm tea, broth, or water with electrolytes. If there is deep cough or tightness in the chest, expectorants like acetylcysteine, ACC 600 mg once daily or ambroxol 30 mg 3 times daily help liquefy mucus and prevent bronchial blockage. They also support antioxidant defense in the lungs. For high-risk patients or early influenza, within the first 48 hours, antiviral medication like oseltamivir, Tamiflu 75 mg twice daily for 5 days can shorten illness by 1 to 2 days and reduce complications by up to 40%. However, it's effective only when started early. To protect the lungs, keep the air humid and clean. Indoor humidity around 45 to 55% prevents airway dryness and reduces coughing fits. Supplements can also help the body recover faster and reduce recurrence. Vitamin C, 500 to 1000 mg twice daily helps shorten colds by about 8 to 14% in studies. Vitamin D, 2000 IU daily supports immune regulation and lowers respiratory infection risk, especially in winter. Zinc, 20 to 30 mg daily, for up to 7 to 10 days, can reduce cold duration if taken early, because zinc interferes with viral replication in the throat. Quercetin, 500 mg twice daily has antiviral and anti-inflammatory effects that support mucosal recovery. N-acetylcysteine, NAC, 600 mg once daily acts as both a mucolytic and an antioxidant, protecting the lungs. Herbal remedies can be useful, too. Echinacea, elderberry, and pelargonium, uncolobo, have shown moderate antiviral and immune-supporting activity. They are not magic cures, but they can make symptoms milder and recovery smoother. Sometimes, just when you think you're well again, the illness returns. You feel better for 2 or 3 days, you go back to work, and suddenly the cough, runny nose, and fatigue come back, often even worse than before. It's a frustrating experience, but it has clear explanations. In studies, about 25 to 35% of people experience this second wave after a cold or flu. It usually happens 3 to 10 days after feeling better, exactly when the body is still fragile. Only 10 to 15% of these are true relapses of the same virus. The rest are secondary infections, immune exhaustion, or exposure to a new virus while the immune system hasn't fully recovered yet. Let's see what really happens. 1. The immune lag. After the fever and inflammation subside, the immune system doesn't return to full strength immediately. T cells and mucosal antibodies, IgA, need 3 to 5 more days to rebuild. During that short window, your mucosa, the body's first defense barrier, is still damaged and dry. That's when viruses or bacteria can easily invade again. This immune lag causes about 30% of all returning colds. 2. Secondary bacterial infection. In around 25 to 30% of cases, the relapse is not a virus but bacteria that take advantage of the weakened mucosa. The most common are Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. They settle in the sinuses or bronchi, causing sinusitis, otitis, or bronchitis. Typical signs: the mucus becomes thick, yellow or green, pain appears in the forehead, cheeks, or behind the eyes, and fever returns. 3. New infection, different virus. Because over 200 viruses can cause a cold, immunity to one doesn't protect from others. When you feel well and go back to crowded places, school, office, or public transport, you can easily catch a new strain. This accounts for about 20 to 25% of relapses. That's why people often say, "I caught the same cold again," but it's actually a different virus, striking while the mucosa is still recovering. 4. Post-viral airway sensitivity. Even after the infection ends, the airways remain hypersensitive for several weeks. Cold air, strong smells, or physical effort can trigger coughing and irritation. This is called post-viral bronchial hyperreactivity, and it affects about 15 to 20% of adults, especially those with mild asthma, allergies, or frequent infections. It's not an active infection anymore, it's inflammation that hasn't fully calmed down. In this case, inhaled corticosteroids, like budesonide 200 micrograms twice daily, or montelukast 10 mg daily for 1 to 2 weeks can reduce reactivity and speed recovery. 5. Overexertion and stress. Returning to work, lack of sleep, or exercising too soon raises cortisol levels, which suppress immune function. Within 48 hours, that can reactivate inflammation or allow residual viruses to multiply again. This mechanism causes about 10 to 15% of relapses, and it's fully preventable. Guideline advice: rest at least 24 to 48 hours after the last symptom disappears. Expert advice: wait until your energy and sleep normalized before resuming physical activity or intense work. This extra day or two prevents relapse far more effectively than any medication.